My name is Lesia Daniels Hollingshead, and I am the co-owner of Funtime Preschool and After School in Clinton. The impact of Corona has been very significant on our program. Before the coronavirus hit and the economy and jobs were impacted by that, our enrollment was right at 360. And currently we have about 56 children enrolled. We were billing over $100,000 a week in tuition. And right now we're billing right about $17,000 a week in tuition. So we had 72 to 80 employees on staff pre-corona, and right now we've got 20. The rest of those being laid off or furloughed. Morale among the staff right now has dipped to a low because the staff members who took the voluntary layoff or who we had to lay off due to enrollment and income are now making more per week than what our staff is who are here working and being paid. Pre-corona, the focus of our program was very much an early education setting. At this point, our program focus has had to shift to health and safety. Not that health and safety are not always a priority, but right now our staff time is devoted so much to hand washing and encouraging social distancing and following the CDC guidelines and recommendations for a safe environment for all of our children and our staff each day, that we are not able to spend time on planning lessons and activities and experiences for the children that we were doing before we were impacted by this virus. I think that our federal guidelines and our state guidelines and then the phrase returning to normal has to be taken in a very loose context. I believe that returning to normal is going to be a new normal that we've not experienced before. Our class sizes of being 9 children with 1 teacher, that is not a norm for us. What I would love for federal and state policymakers to see and know and recognize is that our child care provider workforce is the backbone of the economy in our country, and that this workforce needs to be funded and paid a competitive salary and be able to have benefits that they can provide for their family in a manner that reflects their value and their importance to our society.
Childcare is essential for many American families to be able to return to work, but nearly half of childcare providers have completely closed their facilities, and many may not ever reopen. Closures of childcare providers means more demand for the providers that do reopen and fewer spots for children. In addition, necessary enhanced health and safety measures due to COVID-19 could lead to providers serving fewer children. An overwhelming majority of Americans support providing targeted financial assistance to the childcare industry. Initial efforts to bolster the childcare industry are a start, but funds are already running out or didn't reach the entire industry. Let's ensure that providers are there so that families are able to get back to work when it is safe to do so. Congress must act to ensure that childcare has the robust, dedicated relief it needs. Visit childcareaware.org to learn more about how to advocate for childcare. It's as simple as this: no childcare, no recovery.